Tonight on PM Express, a conversation about a group that seemed to be neglected in the midst of COVID-19. So, quality and accessible mental health care, reducing stigma, prioritizing services in the midst of COVID-19. So, as the country tension heightens due to rise in COVID-19 cases in the country, there's a group of persons that seem neglected. Those are the persons with mental disorder. The United Nations Sustainable Development Goal 3 aims at ensuring every person in every age group living everywhere has access to healthcare services, including mental health care. And of course, that is the basis of the research by Basic Needs Ghana. So the research highlights and reveals that mental, neurological, and substance use disorders are highly stigmatized, neglected in funding, infrastructure, and human resources at all levels of care as compared to the other services of the healthcare system. True, because there are figures and circumstances suggesting this. Now, the research goes on to say there's also very insufficient funding support from the districts, metropolitan, and municipal assemblies. And we'll be interrogating this and also find out whether it is actually their core duty to be funding mental health treatments in their various districts and metropolitan assemblies. Now, it also reveals lack of national health policy that establishes a solid financial base and efficient mental health system. This is very critical, especially at a time when there is a pandemic and everybody's running for their lives. If you watch the general data of even health personnel, frontline health workers, you can understand why these vulnerable people must be given attention. Now, let's go more into the research and recommendations from Basic Needs Ghana. It says prioritization of mental health services in Ghana, especially at the community level. So we need to prioritize and we need to know which areas we must send the prioritization. Now, more community education that includes stakeholders in the health sector, schools, religious bodies, and multi-sectoral involvement to increase awareness and help reduce the stigma. So the bit about stigmatization, and there's no better time to discuss this because sometime last month or 2 months ago, we heard from the Mental Health Authority how some patients contracted the virus and how they were stigmatized, even by health professionals, as to where they should be self-isolated. I mean, where they should be kept to be given treatment. But they're also Ghanaians, remember? So it also recommends that we should undertake real-time, rigorous operational research in mental health service delivery. Are we doing that as a country? Tonight on PM Express, we explore the issue of reducing stigmatization, prioritizing services, especially in the midst of COVID-19. I'll introduce to you my guest when we return from the break. Stay with us. And we are live on PM Express. My guest tonight, Peter Badi Makiaro, he's Executive Director, Basic Needs Ghana. Also, Cecilia Fufo Ashali, Mental Health Service User and Programs Assistant at the Basic Needs Ghana. She'll also be joining the conversation and share some interesting perspectives on all of these. Now, Peter, I'll start with you. I understand how pathetic the situation is, especially in these times of COVID-19. In fact, recently the Mental Health Authority spoke about how some patients who have contracted COVID-19 struggled to get a place for isolation. And he spoke about how even doctors and nurses were stigmatizing these patients. What did your research uncover?
Thank you very much for the opportunity granted us to speak about this study. This study is part of a project that was funded by Star Ghana in 2017. And Star Ghana funding is coming from DFID UK8, Danida, and the EU. And we are grateful to them for the support they've provided us over the years. We decided not just to work to contribute to building access, but also to document experiences on the ground through interviews, observations, and records. And this we did working closely with community psychiatry unit, community mental health nurses, community psychiatry nurses, and some of the district health directorates and medical directorates of hospitals and health centers. And periodically we asked questions about their logistics and funding over the quarter and whatever logistical support they have received or financial support received. And that is how we built this information to the point that we thought we should share widely. And the findings that came out were that most of the community mental health units do not get any funding at all. A lot of them rely on the benevolence of their district directors of health services or their hospital medical directors. So it's not a laid down procedure or budgetary allocation that mental health should be given this amount per year to support community-based services. A lot of it is dependent, sometimes is dependent on the relations between the district mental health officer or the mental health person in charge of the unit and the head of the facility. If it's a good relationship, maybe they'll get some periodic funding in the form of fuel and the rest. If it is not, virtually nothing comes. And so this kind of absence of funding and its haphazard nature affected how much outreach community mental health officers can carry out, because their motorbikes, if they have at all, run on fuel, and they themselves need some stipend at least to drink water whilst in the field. It similarly affected how much medicines can be procured and provided to people who are taking mental health services within the communities. They were unable to respond to emergency situations. So they have to wait in their community psychiatry units, and willing and capable relatives will find whatever ways they can to bring their relatives who have a crisis to be supported. And you can imagine when such patients are a bit aggressive or agitated and have to be brought by relatives to a unit to be supported, you see all sorts of ways by which they marshal the person, bundle the person to bring. It equally affected data collection and record keeping, in the sense that they aren't able to go beyond the cases they see, and that's what they can do. So going out for case search and properly documenting whatever preliminary diagnosis that have been done for follow-ups or the needed referral was also affected. And more so when it comes to keeping stationery or having stationery to keep records in ways that they can be stored for onward transmission. A lot of them don't have laptops. If they have, they are personal in that regard. So these were a key of the findings that were made. And it was again clear that outside of the hospital or the medical facility or the health directorate, district assemblies that have some responsibility as part of decentralization to healthcare services have given virtually nothing to support mental health services, which is a very neglected area.
I would like you to
a cause of concern.
Great. So I want you to position your camera well so we can see you. Cecilia, if you can hear me, I'd like you to share your experience with me on the bit where you're trying to get the care that you need, and then you're finding it difficult to get. I don't know how your experience has been, and I don't know what kind of stories you've also heard from others, from where you sit as programs assistants at the Basic Needs Ghana.
Well, thank you also very much for having me here on your show and for the job you're doing. In terms of attaining quality healthcare services, I would say it has been the best when it comes to Ghana, because sometimes the medications are very expensive to acquire. So imagine me who is even working, and sometimes the medications are expensive for me to buy. How about someone who is not working? Especially in this COVID-19 era where most people have lost their jobs, you can imagine the kind of trauma they will be going through in terms of getting quality access to healthcare delivery when it comes to mental health. So it has not been easy, especially when it comes to medication. Then also when it comes to the facility assessment, it's not something best to write home about, because I have once been, one or two times been admitted at the Accra Psychiatric Hospital, and I wouldn't say the treatment is one of the best, because sometimes you even have to eat a meal without fish or even meat to gain the kind of nutrients you need to help you nourish the body in terms of nutrients to live healthy as required. So it has not been something good to write home about, if I should say, in this regard.
I hope Mr. Yarobadimak is back on like. Let's talk about the mental health law. I know it was formulated to kind of elevate the mental health status to another level. Why are we still talking about this? I mean, why are we still here?
Yes, thank you very much. I was about to say that we are still where we are and talking about this very issue that we have talked about for nearly a decade now, because we are not backing our laws with action. And so, yes, you would hear from many people that Ghana has one of the most innovative or most effective or up-to-date, state-of-the-art, if you want to call it, mental health law from a low and middle-income country or in sub-Saharan Africa. So all that is needed to transform our mental health system to build a very effective, robust, and resilient community mental health system are buried in those provisions. It is now picking them one after the other and backing them by those actions, and those actions would be the logistics and the funding and the genuine interests to see change in the mental health sector happen that is failing the Mental Health Act. Unfortunately, that is it. It's a very good act. It has all that is needed, but it is not backed by concrete words, funding, and the needed support for it to really blossom and be responsive to the mental health needs of the many Ghanaians. As my colleague was saying, many people who have mental health conditions or mental health care needs tend to also have a lot of challenges economically, and that impacts on how they can access services. And it becomes even worse when the services are not within reach. We all talk about community mental health care because it improves geographical access. It enhances and encourages people who have mental health care needs and know that they can get support from such facilities that are within proximity to access them. But when the distance becomes a barrier, people give up, and that is where they go to the nearest places, which may be traditional healer homes, or they rely on spiritualists who sometimes don't support them as effectively as they should because they don't really fully understand the intricacies that are involved in mental health. So yes, we can talk about the mental health law, but it has lost its bite because it has been filled in terms of funding for it to really make mental health what it should be in the country.
In your research report, you talk about 98% treatment gap, and that's also according to the WHO. That is huge. Now, we are aware that almost all district health facilities have mental health units. These were supposed to make treatment services easily accessible to the people, right? So what are the most significant challenges these centralized mental health units face, per your research?
Yeah, again, to be fair to the policy authorities, to health planners and health managers, there has been the drive, and of course, with the complementary support of our organization, Basic Needs Ghana, there has been a drive to have these community mental health units at virtually all district facilities and some sub-district facilities. But that is where the issue starts from. When you establish these facilities, post some personnel, maybe one or two, and then they are left on their own because they are not armed with the tools. So in terms of opening or establishing community mental health units across the country, there has been that move. Commendations to Mental Health Authority, Ghana Health Service, and all actors that have tried to do that. But the worst part is you put somebody there and you don't give him or her the necessary tools and logistics and funding to work with. And you know, if as a host, a very good host as you are, if you were just given the position and not backed by the resources, then you become something else than prove your effectiveness. And that is where the crux of the matter is. The law did not just talk about establishing the mental health units, but backing them with the logistics and even the full complements of personnel that should operate a community mental health unit. Right now, a lot of them don't go beyond just having a community psychiatry nurse or a community mental health officer. And that is even quite a Herculean task for that one person who has to behave and work as a psychiatrist, as a clinical psychologist, as a nurse, as an occupational therapist, and as a social worker. That is, unless you are a magician, that is not very possible. And so such units that are dotted around and staffed with skeletal staff can only do a little of what their training and capacity and abilities and motivation can allow them to.
Quite pathetic there. I'll take a break on PM Express. When I come back, I want to find out, because your report indicts MMDAs for not providing sufficient funding, for instance. I want us to go into that and really find out if it is the function of the MMDAs to assist with health service provision, and I'll also be looking at the rate at which people are stigmatized, especially in this time of COVID-19. Stay with us. Welcome back to PM Express, and I must apologize for the terrible connection we're having tonight. We're trying all possible means to fix it so we can have a beautiful conversation. And before I went on that break, I talked about how your report indicts MMDAs for not providing sufficient funding and support for mental health services in the area. And is this among the core functions of MMDAs to actually assist with health service provision?
Thank you very much. I would say so, yes. It's a core function of the District Assembly when it comes exactly on issues of human development and social protection. So MNDAs, as managing and working for the development of decentralized ministry, department, and agencies, have a role, at least particularly in the thematic area of human development, productivity, and employment, or when you take issues of health and education, they have a role to play. And that is why we think that they need to do more, especially when these are neglected, underfunded sectors. They are more or less orphaned, and it is incumbent on district assemblies to look at the areas that are disadvantaged and bring them up. And that's why it falls quite squarely on them. We are not indicting them as such, but we are just pointing them to what else they need to do, especially when you come to an area that is most disadvantaged and you are thinking of holistic development and prioritizing human development as part of bringing about general development. So in every way, district assemblies have a responsibility. Similarly, the health directors sit in the district assemblies. They are some of the key members of the district assembly management or coordinating bodies. And as they sit there, it should be possible for district assemblies, the core team there, to point them to areas of healthcare services that need more support. And that's why we think district assemblies should focus on this. Yes, it is the case that you still see the health sector having quite a good part of its apron strings tied up with the mother ministry and the mother agency, Ghana Health Service. But that does not mean district assemblies should wash their hands of issues of health, and for that matter, mental health, which is of interest here.
Well, we'll talk about your recommendations, but according to the study also, stigma is still a major problem. This is in spite of significant efforts organizations like yours have put into changing people's attitudes towards mental health issues in Ghana. What are some of the key learnings you can share about this aspect of your work? And what do I mean, our viewers need to know about the effects of this stigma?
Thank you once again. I think it's almost across board that stigma is the #1 challenge that is militating against effective development and transformation of mental health in our country and in many societies. Because if you can hear a government official say, what does a person with mental health condition contribute, that you are bothering us of investing in mental health, we are talking of serious matters, then it is clear that we have a long way to go. And we have heard statements like this. So it is stigma that is influencing how somebody would think that you should put so much to develop mental health or not. It is stigma that will let someone say that, yes, my relative is not well and I need to help him or her get treatment, rather than saying, well, he's a write-off and we cannot do much, let him go, so that we can concentrate our efforts on people who are sane. And it is stigma that will let health workers avoid a person with mental illness instead of helping that person, and calling a medical officer trained as a doctor, calling a psychiatric nurse to attend to a person who has a mental health condition. So unless we all address the issue of stigma by educating ourselves better, by coming to the realization that mental illness is not a death sentence, or is not making someone second class, or someone nearer a beast than being human, then we will be confronted with low political commitment, low investments, and looking down, undermining health workers and all others who want to speak about mental health issues. So it's very major, and we need to do more about it. And our learning everywhere is that the more educated that people are about mental health issues, educated not just academically, but having mental health literacy, understanding humanity, understanding that we are all God's creation, and understanding that nobody born is completely useless, will always have something good to contribute, then we can make a headway. Less than that, we will continue to have the kind of attitude that we are having.
Let me bring in Cecilia here. Cecilia, on the bit about stigmatization, I'm sure you might have gone through, I mean, a myriad of experiences when it comes to stigmatization.
I was saying that in our Ghanaian society, most of the time, you know, mental health conditions are associated with superstitious beliefs. So when it happens like that, people do not want to associate themselves with things like people living with the condition. And I have had my fair share of it, because even when I was going through my relapses, my friends, some of them started saying I'm cursed because I have done something bad against God and God is punishing me for what I have done. It brings down the capacity of even the individual herself or himself. So when it comes to stigma, it is really high, and it's high time we educate people, create more awareness, so that people can know that, hey, if you have the condition, that is not just the end of your life.
Peter, consistently, Ghana's mental health system has received less than 5% of the health budget. Your report recommends that government should increase this amount to at least 20%. How did you arrive at this, and how would this ease the burden? Peter, kindly unmute your audio.
Thank you. I hope you can hear me now.
Clearly.
Yeah, so because we need to start modestly and not raise alarms or raise fears, we thought just proposing 20% should not be too difficult for government to meet. But we do know that a lot is required than just the 20% of the health budget. But that is a starting point. Now, if you have such a high treatment gap, then it needs something closer to a Marshall Plan. And we have had cause to call on government to really think about focusing, giving priority to transforming mental health. Because whether we like it or not, as we can see, our health burden is changing. Our disease and health issues are moving from being mainly communicable to non-communicable. And mental and psychosocial care needs are increasing by the day as we tend to live with chronic conditions. So we cannot wish away mental health, but rather come to terms and invest as massively as we can. Because if we are going to be dealing with non-communicable diseases that people would live with, and they are chronic, be it diabetes, be it high blood pressure, be it whatever, there are psychological dimensions to living with such conditions that we have to build a health system that would respond to such needs. More so, if we, as a country, Ghana, is a signatory to the internationally agreed sustainable development goals, that by 2030, we are going to achieve certain targets, particularly universal health coverage. Neglecting mental health would be a big minus in Ghana being able to achieve universal health coverage. And that is why we are starting with a modest recommendation of 20% increase in investment of the health budget to mental health, but a lot more is required. And this is not just for government, it's also for the corporate sector. It's also for many others who can make a contribution. NGOs that are able to get some funding from wherever can support. And this is where we continue to acknowledge the support of Star Ghana and of DFID in recent times, recent years, that has made significant investments, not just in civil society, but in government agencies such as the Mental Health Authority of Ghana, to position itself to drive the transformation of mental health. We think there are many others who can come on board in country and from outside to support investing in mental health. So the 20% is just a modest recommendation.
So in which critical areas should such allocation be invested in order to see an overall improvement in the mental health system?
Clearly, one is training and retraining of the few staff, helping with redeployment of staff where there are skilled staffing that is addressed, and coupled with that is adequate working space, including consultation rooms, counseling rooms that can allow for privacy and comfort to sit and see your reviews, and medicines. Medicines, as you know, we have equally sung this song many times, that we are not short of efficacious treatment or management of mental health care services. And medicines have been developed that can help manage people's conditions to live and be productive and be less of a burden on families. but this is not being addressed. So dealing with restructuring of the available personnel and increase in human resource training, increase in workspace, coupled with providing adequate medicines to go along with treatment. Because now you would have people, as we talked about, go to these community mental health units, and there are no medicines to support them, and they have to prescribe for people who are on certain medications. If they don't have the medication, they just take the prescription and return home. And you can guess what the next thing would be, a relapse. And sometimes relapse become a lot more serious than when people exhibited or presented the signs and symptoms. So these are key areas that need to be addressed. We know that efforts are being made through the Ghana Health Service, Mental Health Authority to address some of these, but a lot of injection, a lot more commitment to seeing that these happen and happen fairly quickly.
Considering the fact that our COVID-19 cases are surging, and also considering the fact that mental health patients are not exempted from the contraction of this virus, what do you want going forward changed as the country strives to fight this pandemic?
Yeah, thank you again. When COVID and all the measures that have been put in place started, we undertook an active reach out to our, when I say our persons with mental health conditions that basic needs have reached to and worked with, together with our various partners to understand how COVID has impacted them. What we realized was that a lot of them, yes, there seemed to be some extensive or widespread education going on, but a lot of them did not even seem to hear about the need for them to stay home and maintain healthy lifestyle. Those who had and stayed home, all they heard was that they said nobody else should move. Now, knowing that these are people who periodically go for refill of their medicine, who draw peer support from self-help groups that they belong to, having to lose these affected them greatly. A lot of them are already on very fragile livelihoods, either just making do with whatever is available. So the lockdown affected a number of them who started small businesses and couldn't come out to trade. Those who were doing some productive work and didn't have markets to sell their crafts and the rest. We have also had issues around distribution of personal protection equipment, that it goes only to those, they say, who matter in the community. They probably key opinion leaders, known personalities in the community, and persons with mental health conditions are not covered with whatever free donations that are given. This free distribution of food in the epicenters, unfortunately, did not reach numerous people with mental health care conditions who stayed at home and were not on the streets. People we find on the street who have mental health conditions constitute a minute number of the proportion of people who are living with mental health conditions. So neglecting them with a lockdown was an unfortunate thing, and it affected people adversely. Another issue was the issue of testing, that the testing and test kits have not in any way reached people. No one we talked to said he has had any tests, even though they have heard that some people either have been traced and tested. None of the people with mental health conditions that basic needs and partners work with have talked about being tested, or somebody even coming to educate them on the measures to take to keep safe and stay healthy. So this is how COVID-19 and the measures that have been taken to address them have affected persons with mental health conditions. Some are not able to visit the psychiatry units in the various facilities to even take their refill or get a review.
So what do you want changed going forward?
What we want changed is a targeted approach to some of the most vulnerable in our society. And this is not just for persons with mental health and psychological, psychosocial conditions, but even persons with physical disabilities that we have had some idea of have largely been marginalized at the community level in this. So we want to see a targeted approach to them, alleviating the impact of the lockdown on them with regards to food and nutrition, or such other complements that can improve their well-being, including provision of personal protection equipment, particularly nose masks, and even education on how to maintain all the measures that have been proposed. A lot of them have been largely ignored. And this is what we are hoping and expecting and calling and appealing upon governments. Again, local government authorities, district assemblies, that in their outreach in their communities, they should focus on these. And generally, we are also hoping that the government COVID-19 alleviation program makes an intentional and concerted effort to reach the least who sometimes will be silent but are the most affected.
I'm grateful for your time on PM Express. Peter Badimakiaro is Executive Director of Basic Needs Ghana, and also Cecilia Fofo Ashali is Mental Health Service User and Programs Assistant at Basic Needs, who also joined with some experiences she has had. Thank you so much for watching. My name is Aisha Ibrahim. Enjoy the rest of our programs.